Hello everyone, this is Engineer Geo Joseph. In this session, we will discuss about code pink policy. At our private hospital, the safety and security of our youngest patients are of the utmost priority. The code pink policy is a critical component of our emergency response procedures, specifically designed to prevent and respond to infant and child abductions within the hospital premises. This policy ensures that all staff members are trained to recognize potential threats and respond swiftly and effectively to protect our vulnerable pediatric patients. By adhering to the Code Pink protocol, we aim to maintain a secure environment where patients and their families can feel confident in the care and safety provided by our hospital. Purpose of the policy: to describe the measures implemented and to ensure the protection of children, infant and neonates in a PH facility from possible abduction, exchange or from missing, and includes guidelines to be followed in the event of suspected abduction and to provide rapid, organized and immediate response on suspected or actual children, infant and neonate abduction. Code Pink. Definitions in the policy: children or child. For the purpose of this policy, a term used to include infants, newborn in labor and delivery room, obstetrics and gynecology ward, nursery and neonatal intensive care unit, NICU. Children up to age of 12 years, admitted intensive care unit, PICU. Children visiting the hospital premises to see their ill relatives or for checkup in the pediatric outpatient department, OPD, and pediatric emergency room, OPDIA. Abduction is the removal of child without parental permission / medical releases and / or knowledge of nursing or medical staff. Exchanging child released to the wrong parents. Missing child wandered off by him or herself. Code Pink is the hospital emergency code used in APH to denote actual or possible child abduction. Code Pink announcement: it is made via the paging system and clearly stating Code Pink location, Code Pink location, Code Pink location. Code Pink team: it consists of personnel who respond immediately to Code Pink announcement. Responsibilities: 1. Nursing, safety officer or engineer and security staff are responsible for ensuring that this policy is accurate, relevant and current. 2. Other head of departments are responsible for ensuring that all of their staff are aware of this policy. Policy description: identification of staff, patients and visitors. Employee identification: all APH staff shall wear identification ID at all times during the duty hours. Patient identification ID ban: all admitted children, infant and neonates shall have ID band including name, full name and medical record number. Refer to patient identification policy. Infant/child identification: the infant's footprint and mother's thumbprint shall be imprinted on the form by the LDR nurse or midwife before transferring to the NICU or nursery, if the condition of the infants permits. An ICU or nursery staff shall complete this procedure for all infants transferring prior to footprinting and for all direct admission. A Polaroid photograph of the newborn shall be taken and attached on the form along with the mother's thumbprint. Staff education: 1. All nursing staff will be educated during the orientation period and on a quarterly basis. 2. All hospital staff shall be educated about Code Pink through unit-specific orientation, and in-service provided by the nursing department staff shall be given instructions on infant and child protection during new higher orientation by the preceptor. 3. Staff shall encourage to question any unauthorized and or any individual without proper identification seen in the units. Note: Code Pink drill will be conducted by annually in inpatient areas and annually in OPD and R. Instructions and orientation of parents. Inpatient: A. Mother shall be given an infant safety leaflet containing clear and concise B. Instructions on releasing their infant. B. Instruction about infant security issues shall be given to all patients. C. As part of the admission orientation process, staff shall remind and / or advise the parents to identify nursing personnel by ID tag they will be wearing. Access restrictions. In female ward and pediatric ward, patient's room door shall be closed. Nursing staff will observe non-familiar people in the unit. Security personnel will control the visitor through issuing visitors ID cards / tags. In NICU and PICU, doors are kept closed. Parents are allowed to visit only. Security personnel will control the visitors. No visitors are allowed to enter the NICU and nursery. Any authorized personnel in the pediatric ward, female ward, NICU, PICU or nursery unit shall request their identification card by the security members. Discharge procedure. 1. Any children or minors shall be discharged only with guardian, father, mother, grandfather's side other from the forementioned. A special power of attorney would be required as per law and regulations. 2. Newborn baby shall be discharged by the mother and or the father/grandfather from the father's side, other from the above mentioned. A special power of attorney would be required as per law and regulations. 3. In any case of transfer, all infants shall be transported within the hospital incubator, bassinet or crib and shall be accompanied by a unit nursing staff. Any hospital staff shall request to see the identification of any carrying the infant. For example, if the infant is not in a bassinet, and report any problems to the security staff and social worker. 4. The nurse/midwife, nursery/NICU, shall escort the mother and infant on discharge from the female ward, NICU and nursery unit. 5. During Code Pink, no one is allowed to leave the facility without being searched. Code Pink team members are 1. Head nurse and charge nurse of the concerned area. 2. Nursing supervisor. 3. Safety engineer or safety officer. 4. Security supervisor. 5. Social worker. 6. Duty manager. Other members are security officers and nursing staff assigned to all hospital exits. Missing child. Possible abduction. When a nursing staff member suspects that a child is missing or abducted, or there is a suspected exchange during taking head counts for all inpatients, conduct immediate thorough search, 5 minutes, of all rooms in the ward/unit, including storerooms, public toilets, and staff locker rooms. And if the child was not found in the ward/unit, the nursing staff will immediately activate the Code Pink. Presumed abduction. Presumed abduction, immediate response of a PH staff shall 1. Use nurse call system and call 2222 to announce Code Pink overhead paging system. 2. Head nurse, charge nurse and nursing supervisor shall brief and assist the Code Pink team. 3. Director of nursing shall notify the chief executive director. 4. If event occurs after the working hours, the nursing supervisor shall notify the director of nursing, social worker and duty manager. Exchanged or abducted infant, search procedure shall 1. Security staff shall close the internal main building gates in the ground and basement floor and external gates. Gate No. 1, Gate No. 2, Gate No. 3, Gate No. 4, Gate No. 5, Gate No. 6 and Gate No. 7. 2. Maintenance staff shall deactivate all elevators and the Code Pink team will use the emergency elevators, elevator No. 2 and 3, manually. 3. Assigned security officer and nursing staff will proceed to the assigned areas and assist in searching the visitor. 4. Security officer and nursing staff shall continue searching the area which is to be secured. 5. Staff should be alert to any suspicious circumstance. For example, people carrying a child around and in inappropriate areas or people carrying large packages or bags. 6. All hospital staff on duty and present during the Code Pink remains in the unit until released by the security staff. 7. Any visitor leaving the facility must be searched. 8. Nursing staff of involved unit shall perform a visual check of nursing unit and do a head count for all other patients. Continuously reassure parents/family/visitors of their secure the unit. Assist personnel in visitor control and only hospital employees with ID card shall enter. 9. Code Pink is active until resolution or end of search. Code Pink, all clear. 10. Code Pink team members shall report to the nursing admin office and discuss the efficiency of the code. 11. Ongoing response. Safety and security personnel on the scene and coordinating response shall. Anyone leaving the facility must be searched. Leaving is permitted once security arrives and after performing the thoroughly searched. Nursing staff and social worker escort parents of missing and abducted child to another room to provide support and assist in obtaining pertinent information. and searching. If infant/child is found. If the infant/child found in less than 1 hour, transport to Safety and Security Department, basement. Charge nurse will notify the operator by call emergency number 2222 to announce via overhead paging system to stop searching, code ping all clear. If infant/child is not found. If the infant/child not found in 1 hour, safety engineer/officer, security supervisor and FMS director will inform the chief executive officer and duty manager will inform the Aba police according to the instructions. Response to incident. Security supervisor and or assigned security staff will coordinate with the CCTV staff to check recent and historic CCTV to try to identify who may be the abductor. This is critical at an early stage and assists speedy recovery. Post-incident review. OVR to be completed in an event of child exchange, missing and abducted in APH by all staff involved in the incident and to be submitted to Quality and Patient Safety Department. In conclusion, the code pink plan at Aba Private Hospital is a critical component of our commitment to patient safety and security. By establishing clear protocols and ensuring staff are well trained and prepared for infant or child abduction scenarios, we aim to minimize risks and respond swiftly to any threats. The collaborative efforts of all departments and the use of advanced security systems play a vital role in safeguarding the most vulnerable patients. Continuous evaluation and drills will ensure that our code pink plan remains effective and up to date, reinforcing our hospital's dedication to providing a safe and secure environment for all. Thanks for your time. This is Engineer Geo signing off.